We work on Wnt signalling in melanoma, and we've been studying this for a number of years now, and we've found an interesting link between Wnt signalling and the metabolic regulation in melanoma cells. So Wnt signalling can be broadly divided into two distinct signalling subgroups. Those pathways that signal in a beta-catenin independent manner, termed the canonical Wnt signalling pathway, and pathways that signal in a beta-catenin independent manner, termed non-canonical Wnt signalling. And we've looked at both arms of the Wnt signalling network in our work. And what we found is that for the non-canonical Wnt signalling pathway, that this induces aerobic glycolysis in melanoma cells, and that actually this can have an effect on promoting metastasis in those tumors. However, the role of the canonical Wnt pathway in melanoma is a lot less clearly understood. In fact, some research suggests that the Wnt beta-catenin pathway is poor for patient prognosis, whilst other data suggests the opposite, and that's actually good for patient outcome. So we wanted to understand this a bit more. So we started looking at what could be the difference. Potentially there was context-dependent effects within the tumours that were giving this controversy within the literature. So we started to have a look at what the metabolic regulation was from the Wnt beta-catenin signalling pathway in melanoma cells, and we found a huge distinction between melanoma tumours that upregulated p10 and had high p10 expression compared to tumours that had low p10 expression. So what we found was that in tumours that had high p10 expression, if you activate the Wnt beta-catenin signalling pathway, you actually suppress global metabolism, cellular metabolism in those cells, and it has an effect on reducing metastases in various preclinical models that we were using in the lab. However, when we were looking at tumours that had low p10 expression and were activating the Wnt beta-catenin pathway, we saw the exact opposite effect. So we saw an increase in metastatic potential in those cells, and those had a very different metabolic profile to cells with low p10 expression.